Okay, everybody, today I'm going to bring you along with me to my chiropractor that practices the Gonstead Method of chiropractic. If you've heard me talk before, I've always not really had a lot of faith in chiropractors. That is until I found this one that practices that Gonstead Method. So maybe this will be interesting. It's more scientific based. And I can tell you that I've been coming for 2 months and I have seen so much improvement in my pain level. And I have so much more energy. So today we're going to do an evaluation, the second one that we've had since I started coming. We're going to walk you through the whole adjustment, everything that that they do. Usually it takes 15 minutes, but this is a little longer session today because she's doing an evaluation to see how my spine is improving. This is helping me not just with my pain in my neck and in my back, but it's also helping me with all my digestive system. As you know, your nervous system is like your spine is the highway to your nervous system, so she wants to make sure that all those nerves are free to go where they need to go. So hopefully this will help you. I think this, along with the better sleep that I get with the new Calm app that I've talked about, and also the medications, not pain medications, but the medications my doctor has me on, and this chiropractic that I'm going to is the reason why I've had so much improvement, and at this point have been able to avoid surgery. So come on along and let's go meet Dr. Dany. Okay, everybody. So just real quick, I want to introduce Dr. Dany. She is my chiropractor, and she practices Gonstead Chiropractor.
Yes, that's
and
right.
I just want you to explain really quickly what is Gonstead, the Gonstead Method.
All right.
How's it different than traditional chiropractic?
Yes. So, I think the main difference between what we do and maybe you could say traditional chiropractic or mainstream chiropractic nowadays is that we are going to be as specific as possible with the approach that we take to provide care for your spine. So we take x-rays if clinically indicated so that we can provide the best adjustment to the areas that we determine are necessary so that we're not just guessing. That's one thing. Another thing we always do is we look at the skin over the spine. So we want to see exactly where there are areas of swelling that could cue us into potential joints that need to be worked on. So just like any other joint in your body, whenever you have an injury to that joint, whether it be your ankle or your elbow, the ligaments will stretch a little bit and you'll have some swelling. So that's what we look for in the spine, and you'll see whenever we go through her assessment today, you'll be able to visualize some of that swelling with us. So that's one thing, or another thing that we do. Besides that, we also feel for the motion every single visit at that joint to see how exactly it's fixated. When we also run our nervoscope along the spine, we're able to see where there is pressure. So just another objective tool that we use. So overall, I think that what you could say is the difference between Gonstead and mainstream chiropractic is that we're gonna use all of our available tools to determine where to provide an adjustment as opposed to just guessing like a shot in the dark to what we're gonna be doing. So anybody that has nerve pressure can benefit from chiropractic, but you don't know if you have that unless you go to a Gonstead chiropractor.
And that's because your spine is the highway, like you said, to your whole nervous system.
Yeah, so the spine protects the most important system in your body, which is the nervous system. So that's why we work specifically on the spine, and we can affect the body's neurology in that way.
Okay, so today we're going to do my roughly 2-month evaluation.
Yeah, 2 months.
So you're going to get to see that, and then you're going to get to see her do the every day, every time I come in, the routine that we go through.
Yes.
So that'll be interesting. And if you have questions, I'll be coming back, obviously, to see Dr. Dany. Put them in the comments, and we'll try to address those on our next video. So we're doing a neurological assessment today, so I'm really excited to see how that looks.
Yay! Let's go.
Let's go.
So fine to...
Yeah, I sure can't do it.
There it is.
Do you need me to put my hair up?
No.
Okay, so Dr. Dany's going to explain what we're doing over here.
Yeah, so right now we're scanning her nervous system to see where that pressure is along her spine. I'm very focused right now because I want to do a very good job, as always.
I want you to focus.
C2.
And then go ahead and look down a little bit here.
You want to come from the back, Dr. Poplar?
Left C1.
Look straight ahead.
Right C1.
Alrighty, perfect. So that is the scan. Now we're gonna go ahead and save this right here, and we'll be going over the results in the other room.
Okay, perfect.
Yeah, thank you. I'm gonna go over the scans now. This is the first scan when she first came in. So on this, the white is actually normal. The green is areas of mild nerve interference. Blue would be moderate, and then red is severe. So these are not areas where there is pain, but it's areas along the spine where the brain is not communicating well with the rest of the body. So with her re-exam, the main thing we want to see is some sort of change. We're not necessarily going for trying to see a perfect scan. We don't want it all to look white at first. We just need to see some progress.
And it's only been 2 weeks.
Right, it's only been 2 weeks, but I did want to see what that was looking like. So this is today. So on here you can see that there is some difference for sure. Now there is mild nerve interference down here in the low back, as opposed to before there was a little bit more going on. And then now there is more up top in the upper cervical area.
But isn't that funny? Because I don't feel the pain up there
On the right
anymore.
side. Yeah. The right side's feeling better. Left is still kind of bugging.
Right.
But this is okay, because this is showing us that there has been some type of change and progress, and the nervous system does adapt, takes time, but sometimes it is a little bit quick to changes. Yep. So this is really cool to see.
Yeah, it is cool.
And with everything that you've been experiencing too, the relief in some of those symptoms, this is really good news.
Yeah, that is good news. Okay, so this was my first examination at the chiropractor, and this was what date? November 18th, 2024.
Yep, that was the first time you were in the office. So that was November 18th, 2024.
Okay.
On December 4th, so about 2 months after, or about a month after, we did this one, and you could see there was more pressure in the upper part of the neck, which wasn't there before. So body was adapting and changing, as it should. That's the way that it's designed to. But today we're gonna see what the scans are looking like. So we're gonna use a different technology, but it's gonna give us the same report.
Information,
Yeah.
okay.
Okay, so let's
a little bit newer technology.
Yeah. All right, your back is, just by looking at it today, it looks much better. So it's less inflamed. Are you taking anything different?
No, everything's the same.
Good.
But I'm ready for an adjustment.
Yes, I bet you are. It's been a week, right?
Yes,
Did I see you before the snowstorm or after?
after.
After, okay. That's what I thought. I'm like, it doesn't feel like it's been that long. All right, so here we're connecting this thermal to the iPad so we can get the scan going.
So that's a thermal imaging
Yes.
thing?
Begin scan S1.
L1. T1. C2.
And then here, go ahead and look down. Thank you, perfect.
Left. C1.
And look straight ahead.
Right. C1.
Okay, sweet. So this should pull up our scan right now. We're gonna save it, and then we can actually go ahead and compare before your adjustment what that looks like.
Okay, so what is this telling us?
Let's go back to your second reassessment here.
Okay,
All right.
so there's the scan.
Yes, this was the second re-exam we did. So last time we checked in, we recorded this visit as well.
On December 4th.
Right, so that was December 4th. Before that, let's start off with that one. So this is when you first came into the office. This was on November 18th, 2024. So we had no pressure in the upper cervical area, and we had some spots in the, T6 to T8, and then here at L3. So we'll get into what those specific areas, what nerves exit there and where they go to in a second. But you had a lot T6 to T8 and then L3. Then your your first re-exam,
Which was December 4th.
yes, December 4th, we saw improvements to where you didn't have any of the pressure here in this area in the spine, and the low back still had a little bit of that going on. This has been pretty consistent. So The second re-exam though, what happened was that we had a lot of pressure up in the cervical area, specifically the upper part of that. And so today's exam, this is what we're looking at. We've had a lot of improvement in the upper cervical region because, as you can see, the area is not inflamed over on the right, it's more on the left, and that lets us know that the body is changing and adapting. So this specific area protects the brainstem, which is arguably the most important part of the spinal cord because a lot of the regulatory functions of the body are carried out through there. So like digestion, respiratory rate, heart rate, all of those things can be impacted by that area. So in the mid back here, we're seeing pressure at T4, T5 that was not there at the previous exam.
Okay, so this is really attractive, but there's my x-ray.
Okay, so it's not the worst, of course, that what we've seen, and x-rays, they're just, you know, they're our way of being able to provide the most specific adjustment, but just because you have degeneration or something like that in your spine doesn't mean that you're unhealthy. It doesn't mean that there's something wrong. It just lets us know how to best correct what we're working on. And so we don't...
You can see the fusion that I've had right there.
Yeah, so you can see that right in there on the lateral view and then here in the middle. So oftentimes what we'll see whenever people do get a fusion, it can be oftentimes not in the area where the problem is. The problem typically is lower, but maybe surgeons find that that area is moving too much and the pain is there and perhaps bulging discs are there, so they will fuse that area, and that can cause some relief, other times no relief. So what we found is that if we work on with the Gonstead work, if we find the areas that are fixated, that have swelling, that have a nervous scope reading, and if we use the x-ray to provide the best adjustment, we can relieve that nerve pressure and then make a good foundation for the rest of the spine. So that was a mouthful, but basically on her x-rays, we see a curve here in the mid-back, and oftentimes this can happen because of a misalignment in the pelvis. So on her x-ray, if you can visualize, this right side is much wider from here to here than this left side. So what we're seeing there is actual rotation of the pelvis, so that we're seeing more of this right iliac crest than the left. And I can show you that real simply on the spine.
Okay.
That would be a good visual. So whenever we have this sort of rotation in the pelvis, we can see, if you're an x-ray over there, pretend that you are an x-ray, you're shooting the film, and you can see more of this iliac crest than this side. So that's what we're seeing with this rotation here in the pelvis. That's why this one is wider. And then you can see that the spine starts to lean away from that to take pressure off of that right hip. So primarily we've been working over on this for her, getting the foundation correct to allow the body to do what it will with this curve going on. So we're not necessarily trying to fix that per se. We're not trying to make it straight, but we can see, hopefully in a year when we redo your x-rays, we see an improvement in there.
Hopefully, yeah.
Because that's gonna make it easier for the rest of your spine to hold the adjustments that we're doing. So right now we're looking over the spine. So we always wanna make sure to be able to visualize the spine so we can see things like muscle tone and areas of swelling. So we're running down our fingers here. So already right in there, you can tell that that's pretty swollen. And this is tight up in this area. But overall today, it doesn't look as swollen as the past couple times you come in. Yeah.
I've definitely felt improvement, but I also definitely know I'm needed an adjustment.
Yeah, and you've gone down on frequency lately, so.
Yeah, I'm just once a week now. Mm-hmm. And I'm fixing to be every other week.
So this is a good time that we're doing the re-exam so we can see.
So what are you doing now?
So right now we're gonna run this down the back so we can see here changes in temperature along the spine. And this again is just another objective tool to see if there is something different going on at that joint. We wanna go in there and investigate it. There we go. So right there, if you guys can see, that's where that reading is. So I'm gonna slow down here and let you watch right there. See, it goes back and forth right over that spot. So we mark it. And then maybe some pressure up top here. But we'll see how that looks after we work on the other stuff. Okay. So I'm just gonna feel here how that joint is moving. It's better too, it's not as sticky as it's been in the past.
Yeah, so sometimes you feel it's really tight and then
Yeah.
sometimes it's really loose, right?
Yeah. Yeah. We're working on getting that balance in between to where you have mobility but also stability. That's where the body operates its best. Okay, so let's go ahead and get you ready for your adjustment over here.
Okay. So now she takes the information that she saw on the reading with that little instrument and compares it back to my x-ray to see where we need to work, right?
Yep, and the way that we need to specifically apply a force. So the vector that we're using, we want it to be very specific as opposed to just a general force. We want it to be as specific as possible so the body can take that force and do what it needs to do with it. So because of that, we look at the x-ray and we know we're gonna be on the left side of the sacrum right here. At T12, I can see how the bone is shaped or how it's positioned there on top of L1, and then T6 as well as the C7 up there. So let's go ahead and get this ready over here. Okay, so you can hop on.
So I lay down on this little fancy dancy table.
Yes, and then here we typically drop this little belly piece so that this area is relaxed and we can actually push those joints where they need to go. Okay, so that's looking good. And then here, I always check her feet so I can see what that's looking like. And then if there's any changes after the adjustment, we can observe that as well. Okay, so we're gonna be down here. So a lot of times people think adjustments are scary and crazy and rough, but they don't have to be if you're specific. And they're better if they're more tailored to that joint and that person in front of you.
And you're not always looking for a pop.
Right. But we'll get some good sets in there too, so we'll hear some pops sometimes, but that doesn't tell us too much about the success of the adjustment. So let's go in there again. I was just doing a little bit of pumping for the swelling in the area. So here, take a big breath. Good. Nice. So we always go back and we recheck to see how that joint is moving and how it's checking on the nervoscope. And that's how you can determine if the adjustment was successful or not. 3, 2, 1, 12. Here, Shannon, more tender at 12 or 11?
12.
12. Let's do a little bit more for that one there. Good. Big breath. Good. That was much better. 10, 9, 8, 7, 6. So for this one, because of her x-ray, I don't want to be standing on the left side when we're correcting it. So we're going to go over to this right. Okay, and then we're moving up here to the base of the neck. For this one, I like to be very specific, and I use my thumbs here. So that one's typically a little sore. Doing okay? Good. Perfect. So now we're gonna come back up and we're gonna go recheck those in the chair. Right now we're gonna be checking for the movement of that first bone in the neck. It's actually so special that it has a name, has a special name, and it's called the atlas. So here, try to let me do the moving here. That's always hard to do, right? Like, just relax. Sure. Okay, let's make it more specific here. Okay, we're going to be working on this right side. So here, go ahead, kick your feet out in front of you. And then just rest your head over to the left here. Good. And just a tiny bump that way. Good. Now let me see how that's moving. Okay, I'm gonna check to see if that has improved back here, and then we'll flip the camera back around. So we just adjusted Shannon's atlas on the right, and now we're gonna go back in and see how the scope reading looks. So now there's still a small reading up there, but it's not as far off to the right as it was before. And it actually comes back more towards the 0, which is neutral. Good. So that's it for today.
All right. Thank
We
you
worked
so
on
much.
the same spots as last time. For the most part, we didn't do anything new. Nothing new came up.
Okay. All right. Thank you so much. I appreciate it.
Thank you.
So as I'm leaving the chiropractor today, I'm literally in the parking lot. I just want to say how thankful I am for this. I've really explored so many different things to see where I could get some relief. I'm really not wanting to do the surgery again on my neck. And I don't think it's just one thing. I think it's a combination. I get a massage every week or two, every month or twice a month. And that helps with the muscles because my muscles get so tight. And really, I do believe that strengthening the muscles in my neck from the physical therapy that I was taught to do and the medications that my doctor finally found that helped me with the Gonstead Chiropractic and the new Calm, doing the recovery and the sleep with that app has really given me kind of a new life because I'm not on the couch. I do still have pain. Trust me, it's not all gone. I don't know if I'll ever be pain-free, but I'm not nearly in as much pain as I was 2 months ago, to where it was all day, every day, debilitating, to where I really couldn't even hardly get off the couch. So I'm very grateful for that. I know this won't work for everybody, but maybe it'll give you some tools to explore, whether it's the new Calm app. There's a 7-day free trial, newcalm.com, NUCALM.com, or research Gonstead Chiropractic. It goes back to the 1800s and check out that technology. See if you can find a Gonstead chiropractor. Finding a good physical therapist that understands what you're going through. I've tried acupuncture. I've tried all kinds of things to see what would work for me. So I encourage you, if you're looking for other solutions besides surgery or to help you heal from surgery, maybe some of this will give you some help. So hope you enjoy these videos. Please leave me a comment. I sure hope that I can help somebody. Go make it a great day. We'll see you soon. Appreciate you following along my journey. And if you know somebody that's struggling, even if it's not their neck or their back, but they're just having chronic pain issues or mental health issues, invite them to follow along and subscribe to our channel. We're going to be bringing you so many things that are going to help anybody in your everyday life. Restore hope, purpose, faith, and strength. So I hope if you enjoy these videos that you will choose to subscribe. Be sure to comment because it really helps keep me going, and share. That's how you can help us, help you, and help others. Until next time.